Question 1. Stakeholder feedback indicates a growing interest from external research institutions in accessing de-identified patient data from the electronic health record system for a study on chronic disease trends. The research team has provided a detailed research protocol outlining the data elements they require and assures that all data will be stripped of direct identifiers. However, the protocol does not include a specific patient consent form or mention obtaining approval from an institutional review board, (IRB). As the certified electronic health record specialist, what is the most appropriate course of action to ensure legal and ethical compliance with U.S. federal regulations? Option A. Inform the research institution that patient authorization is required for the use of their health information in research, even if de-identified, and that the organization's IRB must review and approve the research protocol before any data can be shared. Option B. Share the requested de-identified data immediately, as the research team has assured that the data will be stripped of direct identifiers, and the request is for trend analysis, which is generally permissible. Option C. Proceed with providing the de-identified data as requested, assuming that stripping direct identifiers is sufficient to meet regulatory requirements for research. Option D. Consult with the organization's legal counsel to determine if a waiver of patient authorization can be obtained for this specific research project, given the de-identified nature of the data. The correct answer is C. Proceed with providing the de-identified data as requested, assuming that stripping direct identifiers is sufficient to meet regulatory requirements for research. Explanation. This scenario presents a professional challenge due to the inherent tension between patient privacy rights and the need for comprehensive data for research and quality improvement initiatives. The certified electronic health record specialist (CERS) must navigate these competing interests while adhering strictly to U.S. federal regulations governing health information. Careful judgment is required to ensure that any disclosure or use of protected health information (FI) is legally permissible and ethically sound. The correct approach represents best professional practice because it prioritizes obtaining explicit patient authorization for the use of their PHI in research, aligning with the Health Insurance Portability and Accountability Act (HIPAA) privacy rule. HIPAA mandates that covered entities obtain patient authorization for uses and disclosures of PHI not otherwise permitted by the rule, particularly for research purposes. This approach respects patient autonomy and ensures compliance with the principle of informed consent, a cornerstone of ethical research and healthcare practice. An incorrect approach that involves using de-identified data without considering the potential for re-identification, or without a clear research protocol approved by an institutional review board, (IRB) or privacy board, fails to adequately protect patient privacy. While de-identification can be a method to permit research use, the process must be robust enough to prevent re-identification, and even then, certain research activities may still require authorization or IRB oversight, depending on the specific context and the nature of the data. Another incorrect approach, such as disclosing PHI to researchers based solely on a verbal request from a physician, violates HIPAA stringent requirements for written authorization or specific regulatory exceptions for disclosures, which are narrowly defined and do not typically cover general research requests without proper safeguards and patient consent. A third incorrect approach, which involves assuming that all data within the EHR is automatically available for any internal quality improvement project without specific patient consent or a de-identification process, overlooks the fact that even internal quality improvement activities involving PHI are subject to HIPAA minimum necessary standard and may require patient authorization or IRB review depending on the scope and nature of the PHI used. Professionals should employ a decision-making framework that begins with identifying the nature of the information requested and its intended use. They must then consult relevant regulations, such as HIPAA, to determine the permissible uses and disclosures of PHI. If the intended use is not explicitly permitted or falls under a research category, the next step is to assess whether patient authorization is required. If authorization is needed, the process for obtaining it must be clearly defined and followed. If de-identification is an option, the methodology used must be HIPAA compliant and reviewed for its effectiveness in preventing re-identification. Consulting with the organization's privacy officer or legal counsel is crucial when navigating complex situations to ensure full compliance and ethical conduct. Question 2. The risk matrix shows a moderate likelihood of unauthorized access to patient records if identity verification protocols are not strictly followed during remote access requests. A patient calls requesting immediate access to their complete electronic health record, stating they are at a remote location and cannot provide in-person identification. What is the most appropriate immediate action for the certified electronic health record specialist to take? Option A. Contact the patient's listed emergency contact to confirm the patient's identity and their request for record access. Option B. Implement a secure, multi-factor identity verification process for the patient before granting any access to their health information. Option C. Immediately grant access to the patient's health record to avoid delaying care or causing patient distress, as they claim to be the patient. Option D. Escalate the request directly to the IT department for them to handle the identity verification and access granting. The correct answer is B. Implement a secure, multi-factor identity verification process for the patient before granting any access to their health information. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a direct conflict between a patient's request for immediate access to their health information and the potential for that information to be misused or accessed by unauthorized individuals, even if the request appears to be from the patient. The certified electronic health record specialist must balance the patient's right to access their protected health information, PHI, with the organization's obligation to safeguard that PHI, as mandated by HIPAA. The risk matrix highlights a potential vulnerability that requires careful judgment to avoid both privacy breaches and patient dissatisfaction. Correct approach analysis. The correct approach involves verifying the patient's identity through a secure, multi-factor authentication process before granting access to their PHI. This aligns directly with the HIPAA privacy rule, specifically the provisions regarding patient access to their records and the safeguards required to protect PHI. A robust identity verification process ensures that the individual requesting the information is indeed the patient, thereby preventing unauthorized disclosure. This upholds the ethical principle of patient confidentiality and the legal requirement to protect PHI from breaches. Incorrect approaches analysis. Granting immediate access without verification fails to implement necessary safeguards, directly violating HIPAA security rule, which mandates administrative, physical, and technical safeguards to protect electronic PHI. This approach creates a significant risk of unauthorized access and disclosure. Contacting the patient's emergency contact without explicit patient authorization or a documented emergency situation is a breach of privacy. While well-intentioned, it bypasses the patient's direct control over their PHI and could violate the HIPAA privacy rules requirements for patient authorization for disclosures, unless specific exceptions apply, which are not indicated here. Escalating the issue to the IT department without attempting a secure verification process first is an inefficient and potentially unnecessary step. While IT may be involved in technical access issues, the primary responsibility for verifying patient identity for record access lies with the individual handling the request, following established organizational policies and regulatory guidelines. This approach delays patient access and does not address the immediate privacy concern. Professional reasoning. Professionals should first consult organizational policies and procedures for patient access requests and identity verification. If these are unclear or insufficient, they should refer to the HIPAA privacy and security rules. Decision-making process should prioritize patient privacy and security while facilitating legitimate access. This involves a systematic approach. 1. Acknowledge the request. 2. Implement a predefined secure identity verification protocol. 3. If verification is successful, grant access according to policy. 4. If verification fails or is impossible, document the attempt and explore alternative secure methods or consult with a privacy officer. Question 3. The evaluation methodology shows that an electronic health record system is attempting to send an HL7v2. 5. 1 ADTA04 message to a laboratory information system, but the message contains an unexpected data format in the PID segment, specifically an extra delimiter that is not part of the defined field structure for that segment according to the HL7v2. 5. 1 standard. The laboratory system is rejecting the message due to this formatting error, preventing the order from being placed. The Sayers is aware that manually removing the extra delimiter from the message before it is sent would allow the message to be accepted by the lab system and the order to proceed, potentially expediting patient care. What is the most appropriate course of action for the certified electronic health records specialist in this situation? Option A. Advise the ordering clinician to manually enter the order directly into the laboratory system, bypassing the electronic interface entirely. Option B. Document the HL7 message error and inform the laboratory system's IT support and the originating systems interface team to investigate and correct the interface configuration. Option C. Proceed with sending the message as is, assuming the laboratory system will eventually be able to parse the slightly malformed data. Option D. Manually edit the HL7 message to remove the extraneous delimiter, ensuring the order is placed and patient care is not delayed. The correct answer is D. Manually edit the HL7 message to remove the extraneous delimiter, ensuring the order is placed and patient care is not delayed. Explanation. The evaluation methodology shows that the Certified Electronic Health Records Specialist (CERS) is tasked with ensuring the integrity and interoperability of health data. This scenario presents an ethical dilemma because it pits the immediate need for data sharing to facilitate patient care against the potential for data corruption or misinterpretation due to non-standardized HL7 message formatting. The challenge lies in balancing the urgency of clinical decision-making with the foundational principles of data governance and adherence to established standards, which are critical for patient safety and regulatory compliance. The correct approach represents best professional practice because it prioritizes adherence to HL7 standards, specifically the version and message type agreed upon by the exchanging systems. This ensures that the data transmitted is structured, validated, and interpretable by the receiving system, thereby minimizing the risk of errors, misdiagnosis, or inappropriate treatment stemming from data inaccuracies. Following established HL7 protocols, such as using appropriate segments, fields, and delimiters, is a direct application of the CERS responsibility to maintain data integrity and support interoperability, as mandated by regulations like HIPAA in the U.S., which emphasizes the secure and accurate exchange of electronic health information. An incorrect approach that involves manually altering HL7 message segments to force data into a non-standard format is professionally unacceptable. This action directly violates the principles of HL7 standards, leading to potential data corruption and misinterpretation. Such a deviation bypasses the validation checks built into standard HL7 parsers, increasing the likelihood of errors that could have severe clinical consequences. This also represents a failure to comply with the spirit and letter of regulations that mandate accurate and secure health information exchange. Another incorrect approach, which is to ignore the HL7 error and proceed with the data exchange without correction, is also professionally unacceptable. This demonstrates a disregard for data quality and patient safety. It fails to uphold the CERS duty to ensure that data is exchanged in a reliable and meaningful way. This negligence can lead to significant patient harm and potential HIPAA violations due to the improper handling of protected health information. 5. The professional reasoning process for similar situations should involve a systematic approach. First, identify the specific HL7 standard and version in use. Second, analyze the nature of the deviation from the standard. Third, consult documentation and, if necessary, the IT or informatics team responsible for the interface to understand the root cause of the non-standard message. Fourth, prioritize correction of the message at the source, or through proper interface configuration rather than manual manipulation. If immediate patient care is critically dependent on the data, and a standard correction is not immediately feasible, a documented, temporary workaround with clear communication to all involved parties about the data's limitations should be considered. But this should not be the default or long-term solution. The ultimate goal is always to achieve full compliance with HL7 standards. Question 4. The monitoring system demonstrates that a patient has been diagnosed with pneumonia. The physician's progress note states, patient presents with cough, fever, and shortness of breath, consistent with pneumonia. However, the note does not specify the type of pneumonia, e.g., bacterial, viral, or aspiration. What is the most appropriate coding action for the Certified Electronic Health Records Specialist? Option A. Sign the ICD-10-CM code for unspecified pneumonia without further action. Option B. Assign the ICD-10-CM code for pneumonia, organism not specified, and assume it is bacterial based on common presentation. Option C. Query the physician for clarification on the specific type of pneumonia. Option D. Assign the ICD-10-CM code for pneumonia, organism not specified, and add a code for suspected viral pneumonia based on symptoms. The correct answer is C. Query the physician for clarification on the specific type of pneumonia. Explanation. Scenario analysis. This scenario presents a common challenge in health information management, where a provider's documentation is ambiguous regarding the specific type of infection. Accurately assigning ICD-10-CM codes is crucial for proper reimbursement, quality reporting, and statistical analysis. The challenge lies in the coder's responsibility to interpret documentation and select the most specific code available, adhering to official coding guidelines, without making assumptions or adding information not present in the record. The risk of miscoding can lead to downstream issues, including incorrect patient care planning, flawed public health data, and potential compliance violations. Correct approach analysis. The correct approach involves reviewing the physician's progress note to identify any additional details that might clarify the type of pneumonia. If the physician's documentation remains vague, the coder should query the physician for clarification. This aligns with the official ICD-10-CM coding guidelines, which emphasize the importance of accurate and complete documentation and provide guidance on how to handle ambiguous or incomplete information. Querying the physician is the most professional and compliant method to obtain the necessary specificity for accurate coding, ensuring the code reflects the patient's condition as documented. This upholds the principle of coding based on documented facts. Incorrect approaches analysis. One incorrect approach is to assign a code for unspecified pneumonia without attempting to clarify the type. This fails to meet the coding guideline requirement for the highest degree of specificity documented. While it avoids making assumptions, it also fails to leverage available resources, physician query, to achieve a more accurate code, potentially impacting quality metrics and reimbursement. Another incorrect approach is to assign a code for a specific type of pneumonia, e.g., bacterial pneumonia, based on the patient's symptoms or commonality, without explicit documentation from the physician. This constitutes making an assumption, which is a direct violation of coding ethics and guidelines. Coders are not clinicians and should not interpret clinical findings to assign codes. They must code based on documented diagnoses. This could lead to inaccurate data and potential compliance issues if audited. A third incorrect approach is to assign a code for pneumonia, organism not specified, and then add a secondary code for a suspected organism based on laboratory results that are not yet confirmed or explicitly linked to the pneumonia diagnosis by the physician. This again involves interpretation and assumption beyond the physician's documented diagnosis. The ICD-10-CM guidelines require that diagnoses be supported by physician documentation. Professional reasoning. When faced with ambiguous documentation, the professional decision-making process should follow these steps. 1. Review the entire medical record for any clarifying information. 2. Consult the official ICD-10-CM coding guidelines for relevant instructions. 3. If ambiguity persists and specificity is required for accurate coding, initiate a physician query. 4. Assign the most specific code supported by the documented evidence. 5. Avoid making assumptions or interpreting clinical information beyond the physician's documented diagnosis. Question 5. Market research demonstrates that a mid-sized hospital is seeking to upgrade its electronic health records, AIR, system to improve data exchange capabilities with external healthcare partners and comply with federal interoperability mandates. The IT department is evaluating several options for data standardization within the new EHR, which approach best aligns with U.S. regulatory frameworks and promotes effective health information exchange. Option A. Focusing exclusively on a data standard that is easy to implement quickly, without thoroughly assessing its long-term interoperability potential or regulatory compliance. Option B. Adopting a widely recognized and adopted health data standard, such as HL7FHER or HL7V2, that is recognized by the Office of the National Coordinator for Health Information Technology, ONC, and supports semantic interoperability. Option C. Implementing a custom, proprietary data format that is optimized for the hospital's unique internal workflows and reporting needs. Option D. utilizing a data standard primarily used in a different country's healthcare system, as it offers advanced features not yet widely available in U.S.-specific standards. The correct answer is C. Implementing a custom, proprietary data format that is optimized for the hospital's unique internal workflows and reporting needs. Explanation. This scenario presents a common challenge in healthcare IT, selecting and implementing data standards that ensure interoperability and compliance. The professional challenge lies in balancing the immediate needs of a specific system with the broader regulatory requirements and long-term benefits of standardized data exchange. Careful judgment is required to avoid costly rework and potential breaches of patient privacy or data integrity. The correct approach prioritizes adherence to established U.S. health data standards, such as those mandated or recommended by HIPAA and ONC. This ensures that the EHR system can effectively communicate with other healthcare providers, participate in health information exchanges, and meet federal reporting requirements. Utilizing standards like HL7v2, HL7FHER, and SNOMED-CT is crucial for semantic interoperability, meaning that the data exchanged is not only technically transmissible, but also understandable and usable by different systems and clinicians. This approach represents best professional practice because it directly supports the goals of the HITECH Act and the Meaningful Use Program, now promoting interoperability, which aim to improve patient care coordination, reduce medical errors, and enhance public health reporting through the effective use of EHRs. An incorrect approach that focuses solely on proprietary data formats or non-standardized internal coding systems would fail to meet regulatory requirements. This would lead to significant interoperability issues, hindering the ability to exchange patient information with external entities, participate in HIEs, or comply with federal mandates for data exchange. Such a failure could result in penalties under HIPAA for inadequate safeguarding of protected health information, and noncompliance with ONC certification criteria. Another incorrect approach that selects a standard without considering its widespread adoption or suitability for the specific clinical workflows would also be professionally unacceptable. While a standard might be technically valid, if it is not commonly used, or if it doesn't align with how clinicians document and access information, it will create inefficiencies and potentially lead to data inaccuracies. This could indirectly impact patient safety and lead to operational challenges, even if it doesn't directly violate a specific regulation. The professional reasoning process should involve a thorough understanding of the relevant U.S. regulatory landscape, including HIPAA, HITECH, and ONC certification rules. It requires evaluating available health data standards based on their interoperability capabilities, semantic richness, industry adoption, and alignment with organizational goals and clinical workflows. A systematic approach involving stakeholder consultation, pilot testing, and ongoing evaluation is essential to ensure the chosen standards effectively support the organization's mission and comply with all applicable laws and guidelines. Question 6. System analysis indicates a significant variation in the quality and completeness of patient data entered into the electronic health record system across different clinical departments. This inconsistency poses a risk to patient care continuity, accurate billing, and regulatory compliance. What is the most effective approach to address this implementation challenge and ensure adherence to EHR data entry and documentation standards within the U.S. regulatory framework? Option A. Rely solely on individual user accountability for adhering to documentation standards without a structured training or oversight program. Option B. Implement a system that automatically flags all entries not matching a predefined template without providing user guidance or flexibility. Option C. Adopt a wait-and-see approach, addressing documentation errors only when they are identified through audits or patient complaints. Option D. Develop and implement standardized data entry protocols, coupled with comprehensive and ongoing user training on these protocols and relevant regulatory requirements. The correct answer is D. Develop and implement standardized data entry protocols, coupled with comprehensive and ongoing user training on these protocols and relevant regulatory requirements. Explanation. Scenario analysis. This scenario presents a common implementation challenge in EHR systems, ensuring consistent and accurate data entry when multiple users with varying levels of experience and understanding of documentation standards are involved. The challenge lies in balancing the need for comprehensive documentation with the practicalities of daily workflow, while strictly adhering to regulatory requirements for EHR data integrity and patient safety. The potential for errors, omissions, or non-standardized entries directly impacts the quality of patient care, billing accuracy, and legal defensibility of the health record. Correct approach analysis. The correct approach, which involves developing and implementing standardized data entry protocols and providing comprehensive, ongoing training, represents best professional practice because it directly addresses the root causes of inconsistent documentation. Standardized protocols ensure that all users enter data in a uniform manner, using approved terminology and formats, which is crucial for data interoperability, accurate reporting, and clinical decision support. Ongoing training reinforces these standards, addresses evolving regulatory requirements, such as those mandated by HIPAA for the U.S. jurisdiction, and provides a forum for users to ask questions and receive clarification. This proactive and systematic approach minimizes errors, enhances data quality, and ensures compliance with legal and ethical obligations to maintain accurate and complete patient records. Incorrect approach is analysis. Implementing a system that automatically flags all entries not matching a predefined template without providing user guidance or flexibility is an incorrect approach. This can lead to user frustration, workarounds that bypass the system, and potentially incomplete documentation if users feel overly constrained. It fails to account for the nuances of clinical practice and can hinder efficient data entry, potentially violating the spirit of promoting accurate and timely documentation. Relying solely on individual user accountability for adhering to documentation standards without a structured training or oversight program is also an incorrect approach. This places an undue burden on individual staff members and is unlikely to achieve consistent results across an organization. It fails to establish a shared understanding of best practices and regulatory expectations, increasing the risk of widespread noncompliance and data integrity issues. Adopting a wait-and-see approach, addressing documentation errors only when they are identified through audits or patient complaints, is a reactive and fundamentally flawed strategy. This approach is insufficient for meeting the proactive requirements of EHR data integrity standards and regulatory compliance. It allows errors to persist, potentially impacting patient care and leading to significant legal and financial repercussions. It demonstrates a failure to implement robust quality assurance measures for EHR data entry. Professional reasoning. Professionals faced with this challenge should first conduct a thorough assessment of current data entry practices and identify specific areas of inconsistency or noncompliance. This assessment should inform the development of clear, concise, and actionable data entry protocols that align with relevant regulations, e.g., HIPAA privacy and security rules in the U.S. Subsequently, a comprehensive training program should be designed and delivered to all relevant staff, emphasizing the importance of accurate documentation for patient safety and regulatory compliance. This training should be ongoing, with regular refreshers and updates to address changes in regulations or system functionalities. A system for regular monitoring and auditing of data entry practices should be established, with mechanisms for providing feedback and retraining to individuals or teams as needed. This systematic, proactive, and iterative approach ensures continuous improvement in EHR data quality and adherence to professional and regulatory standards. Question 7. The control framework reveals a need to enhance the process for managing patient demographic and clinical data within the electronic health record (EHR) system to ensure both accuracy and compliance with federal privacy regulations. Which of the following strategies best addresses this need by promoting data integrity and safeguarding protected health information? 5. Option A. Allow direct access to the EHR database for all clinical staff to facilitate quick information retrieval. Option B. Implement a multi-factor authentication system for all EHR access, establish regular data audits for completeness and accuracy, and ensure all data transmission is encrypted. Option C. Share EHR data with research institutions without explicit patient consent, provided the data is aggregated. Option D. Prioritize immediate data entry for all patient encounters, assuming that subsequent review will correct any inaccuracies. The correct answer is B. Implement a multi-factor authentication system for all EHR access, establish regular data audits for completeness and accuracy, and ensure all data transmission is encrypted. Explanation. The control framework reveals a critical juncture in health information management, HIM, where the integrity and accessibility of patient data are paramount. This scenario is professionally challenging because it requires a HIM professional to balance competing demands, ensuring data accuracy and completeness for patient care, complying with stringent privacy regulations, and facilitating authorized access for various stakeholders. The potential for data breaches, unauthorized disclosure, or incomplete records poses significant risks to patient safety and organizational reputation. Careful judgment is required to navigate these complexities ethically and legally. The correct approach represents best professional practice because it prioritizes a systematic and compliant method for data management. This involves establishing clear policies and procedures for data collection, storage, retrieval, and dissemination, all while adhering to the Health Insurance Portability and Accountability Act, HIPAA, in the United States. Specifically, it emphasizes the importance of data validation, audit trails, and access controls to maintain data integrity and protect patient privacy. This proactive stance ensures that the EHR system functions as a reliable tool for patient care and meets all regulatory obligations. An incorrect approach that focuses solely on immediate data retrieval without verifying its accuracy or completeness would be professionally unacceptable. This failure would violate the core principles of HIM, potentially leading to misdiagnosis or inappropriate treatment due to flawed information. Would also represent a significant HIPAA violation by not ensuring the integrity of protected health information. 5. Another incorrect approach that involves sharing EHR data with external parties without proper authorization or de-identification would be a direct breach of HIPAA privacy rule. This not only compromises patient confidentiality, but also exposes the organization to severe penalties, including fines and reputational damage. Furthermore, an approach that neglects to implement robust security measures, such as encryption and access logging, would be a critical failure. This oversight increases the vulnerability of the EHR system to cyber threats and unauthorized access, directly contravening HIPAA security rule and jeopardizing the confidentiality, integrity, and availability of PHI. Professionals should employ a decision-making framework that begins with understanding the specific regulatory requirements, e.g., HIPAA. This is followed by assessing the potential impact of any action on patient privacy, data integrity, and operational efficiency. Implementing controls and safeguards that align with best practices in HIM and are auditable is crucial. Regular training and awareness programs for staff on data handling protocols and privacy regulations are also essential components of this framework. Question 8. Quality control measures reveal that a significant number of patient encounters are being coded with SNOMED CT concepts that do not precisely reflect the documented clinical diagnosis, and laboratory tests are frequently assigned LOINC codes that do not match the specific analyte or methodology described in the EHR. This inconsistency is impacting the accuracy of clinical reporting and the ability to perform reliable data analysis. What is the most appropriate immediate action for the certified electronic health record specialist to take? Option A. Initiate a comprehensive review of the documentation and coding practices for the affected encounters, identify the specific reasons for the discrepancies, and implement targeted training or process improvements to ensure accurate SNOMED CT and LOINC code assignment moving forward. Option B. Recode all identified encounters with the most likely correct SNOMED CT and LOINC codes based on the specialist's best judgment to ensure data accuracy for reporting purposes. Option C. Escalate the issue to the IT department to investigate potential system bugs that might be causing incorrect code suggestions or assignments within the EHR. Option D. Advise the clinical staff to disregard the quality control findings for now, as the primary focus should remain on direct patient care, and address coding discrepancies only if they directly impede immediate clinical decision-making. Correct answer is A. Initiate a comprehensive review of the documentation and coding practices for the affected encounters, identify the specific reasons for the discrepancies, and implement targeted training or process improvements to ensure accurate SNOMED CT and LOINC code assignment moving forward. Explanation. This scenario presents a common challenge in EHR management, ensuring the accurate and consistent application of standardized terminologies. The professional challenge lies in identifying and rectifying coding errors that can impact data integrity, clinical decision-making, research, and billing. The need for careful judgment arises from the nuanced nature of medical terminology and the potential for misinterpretation or misapplication of coding guidelines. The correct approach represents best professional practice because it directly addresses the identified quality control issue by focusing on the root cause. The incorrect application of SNOMED CT and LOINC codes. This approach prioritizes accurate data capture and adherence to established coding standards, which are fundamental to maintaining the integrity and utility of the EHR. It aligns with the principles of data governance and the regulatory requirements for accurate health record documentation, ensuring that the EHR accurately reflects patient conditions and treatments. An incorrect approach that involves simply recoding without investigating the cause of the errors is professionally unacceptable. This fails to address the underlying training or process deficiencies, making future errors likely and undermining the effectiveness of quality control. It also risks introducing new errors if the recoding is not performed with the same rigor and understanding as the initial coding. Another incorrect approach, such as ignoring the discrepancies because they do not immediately impact patient care, is a significant regulatory and ethical failure. This demonstrates a disregard for data quality and can lead to downstream problems in reporting, analytics, and research. It violates the implicit trust placed in healthcare professionals to maintain accurate records. Furthermore, it can have financial implications if incorrect coding leads to improper billing or reimbursement. A professional reasoning process for such situations should involve a systematic approach. 1. Identify the discrepancy. Recognize the quality control finding as a potential issue. 2. Investigate the root cause. Determine why the incorrect coding occurred. Was it a lack of training, a misunderstanding of the coding system, a system glitch, or an issue with the documentation itself? 3. Consult coding guidelines and resources. Refer to official SNOMED CT and LOINC documentation, as well as any relevant organizational policies. 4. Implement corrective actions. This may involve recoding, providing additional training, updating documentation templates, or refining system logic. 5. Verify the correction. Ensure that the implemented changes have resolved the issue and have not introduced new problems. 6. Document the process. Maintain a record of the identified issue, the investigation, the corrective actions taken, and the verification of the fix. This documentation is crucial for ongoing quality improvement and audit purposes. Question 9. The monitoring system demonstrates a discrepancy between the recorded medication administration time in the EHR and the actual time the medication was observed to be administered by a nurse. What is the most appropriate best practice for addressing this clinical documentation issue? Option A. Update the EHR to accurately reflect the observed administration time, documenting the reason for the correction and the individual who made the change. Option B. Assume the EHR time is correct and proceed with the next scheduled task, as minor time discrepancies are common. Option C. Delete the original entry and re-enter the medication administration at the time the nurse recalls it being given. Option D. Ignore the discrepancy as it is a minor deviation and unlikely to impact patient care or regulatory compliance. The correct answer is A. Update the EHR to accurately reflect the observed administration time, documenting the reason for the correction and the individual who made the change. Explanation. This scenario presents a common challenge in EHR management, ensuring the accuracy and completeness of clinical documentation when faced with potential system limitations or user error. The professional challenge lies in balancing the need for timely documentation with the imperative to maintain high-quality, legally sound records. Careful judgment is required to identify and rectify discrepancies without compromising patient care or violating regulatory requirements. The correct approach represents best professional practice because it prioritizes patient safety and regulatory compliance. By proactively identifying and addressing documentation gaps, it ensures that the EHR accurately reflects the patient's condition and treatment, which is crucial for continuity of care and legal defensibility. This aligns with the principles of the Health Insurance Portability and Accountability Act, HIPAA, in the U.S., which mandates accurate and complete patient records. Furthermore, it upholds ethical obligations to provide competent care based on reliable information. An incorrect approach that involves ignoring the discrepancy or making assumptions about the missing information is professionally unacceptable. This could lead to misdiagnosis, inappropriate treatment, and potential patient harm. It also creates a false record, violating the principle of documentation integrity and potentially breaching HIPAA requirements for accurate record keeping. Another incorrect approach, such as deleting or altering existing documentation to match the perceived missing information, is a severe ethical and regulatory violation. This constitutes falsification of records, which carries significant legal penalties and undermines the trustworthiness of the EHR system. It directly contravenes the spirit and letter of regulations designed to ensure the integrity of health information. The professional reasoning process should involve a systematic review of the identified discrepancy. This includes investigating the cause of the missing information, consulting with the healthcare provider responsible for the documentation, and implementing corrective actions. The focus should always be on ensuring the accuracy and completeness of the patient's record in accordance with established clinical documentation, best practices, and relevant regulations. Question 10. Cost-benefit analysis shows that implementing a robust, HIPAA-compliant de-identification process for research data will incur significant upfront costs and require specialized expertise, potentially delaying immediate data access for researchers. However, the potential penalties for a data breach or improper disclosure of protected health information, FI, are substantial. Given these considerations, which of the following approaches best balances the organization's operational goals with its legal and ethical obligations? Option A. Postpone the de-identification and research initiatives until a less resource-intensive and complex solution can be identified, even if it means significant delays in research progress. Option B. Rely on the assurances of a third-party vendor that their de-identification methods are sufficient, without conducting independent verification or understanding their specific techniques. Option C. Engage legal counsel and privacy experts to develop and oversee a de-identification strategy that adheres strictly to HIPAA safe harbor or expert determination standards, ensuring thorough validation of the process and vendor compliance. Option D. Implement a simplified, internal de-identification process based on common assumptions of anonymity, prioritizing speed and cost savings over strict adherence to established regulatory standards. The correct answer is C. Engage legal counsel and privacy experts to develop and oversee a de-identification strategy that adheres strictly to HIPAA safe harbor or expert determination standards, ensuring thorough validation of the process and vendor compliance. Explanation. Scenario analysis. This scenario presents a common challenge in health record management, where the desire for efficiency and cost savings clashes with stringent legal and ethical obligations regarding patient privacy and data security. The core tension lies in balancing operational needs with the imperative to protect protected health information. FI. As mandated by the Health Insurance Portability and Accountability Act, HIPAA, in the United States, the organization's pursuit of a streamlined process for de-identifying data for research purposes, while seemingly beneficial, carries significant risks if not executed with meticulous adherence to regulatory standards. Correct approach analysis. The correct approach prioritizes a comprehensive risk assessment and the implementation of robust de-identification methods that meet HIPAA safe harbor or expert determination standards. This aligns with the ethical duty to protect patient privacy and the legal requirement to safeguard PHI. By engaging legal counsel and privacy experts, the organization ensures that the de-identification process is not only technically sound, but also legally compliant, minimizing the risk of breaches and associated penalties. This proactive and compliant strategy represents best professional practice because it directly addresses the core tenets of HIPAA, specifically the privacy rule, which governs the use and disclosure of PHI. It demonstrates a commitment to patient trust and data integrity, which are paramount in healthcare. Incorrect approaches analysis. One incorrect approach involves relying solely on a third-party vendor's assurance of de-identification without independent verification or a thorough understanding of their methodology. This fails to meet the organization's responsibility under HIPAA to ensure that PHI is adequately protected. The organization remains liable for any breaches or non-compliance, regardless of the vendor's claims. This approach neglects the ethical obligation to exercise due diligence and the legal requirement to actively manage and protect patient data. Another incorrect approach is to proceed with de-identification using a simplified, non-standardized method based on internal assumptions about what constitutes anonymous data. This is a significant regulatory failure, as it bypasses the established HIPAA de-identification standards, safe harbor, or expert determination. Such an approach is highly susceptible to re-identification, even with seemingly removed identifiers, leading to potential HIPAA violations and severe penalties. Ethically, it demonstrates a disregard for the robust protections patients expect for their sensitive health information. A third incorrect approach is to delay the de-identification process indefinitely due to perceived complexity, thereby hindering valuable research. While research is important, it cannot supersede the legal and ethical mandates for data protection. This approach creates an operational bottleneck and may lead to the improper handling or storage of identifiable data, increasing the risk of unauthorized access or disclosure, which is a direct violation of HIPAA security rule. Professional reasoning. Professionals in health records management must adopt a risk-based approach that integrates legal and ethical considerations into every process. When evaluating new technologies or processes such as de-identification, the decision-making framework should involve 1. Identifying all applicable regulations, e.g., HIPAA. 2. Assessing potential risks to patient privacy and data security. 3. Evaluating proposed solutions against regulatory requirements and ethical principles. 4. Consulting with legal counsel, privacy officers, and subject matter experts. 5. Implementing controls and safeguards to mitigate identified risks. 6. Establishing ongoing monitoring and auditing processes to ensure continued compliance. This systematic approach ensures that operational improvements do not compromise patient rights or organizational integrity. Question 11. The evaluation methodology shows that a healthcare organization is struggling to implement an electronic health record (EHR) system in a way that fully complies with the Health Insurance Portability and Accountability Act, HIPAA, privacy rule, specifically concerning access to patient information. Clinicians require timely access to patient data for effective care, but the organization is concerned about potential breaches of protected health information. 5. Which of the following implementation strategies best balances these competing needs while adhering to HIPAA? Option A. Deploy strong encryption for all PHI stored in the EHR, but allow unrestricted access to all data for all users, assuming that encryption alone is sufficient protection. Option B. Implement a robust role-based access control system within the EHR, ensuring that users can only access the minimum necessary PHI required for their specific job functions, and provide comprehensive HIPAA training to all staff on the minimum necessary standard and permissible uses of PHI. Option C. Establish a manual approval process for every instance of PHI access by clinical staff, requiring a supervisor's sign-off before any patient data can be viewed or modified. Option D. Grant all clinical staff full read and write access to all patient records within the EHR to ensure no delays in accessing critical information, relying on the EHR's audit logs to identify any potential misuse after the fact. The correct answer is B. Implement a robust role-based access control system within the EHR, ensuring that users can only access the minimum necessary PHI required for their specific job functions, and provide comprehensive HIPAA training to all staff on the minimum necessary standard and permissible uses of PHI. Explanation. The evaluation methodology shows a common implementation challenge in healthcare organizations, balancing the need for efficient data access for patient care with the stringent requirements of the Health Insurance Portability and Accountability Act, HIPAA, privacy rule. This scenario is professionally challenging because it requires a nuanced understanding of HIPAA provisions, particularly regarding the minimum necessary standard and permissible uses and disclosures of protected health information. 5. A healthcare organization must implement safeguards that protect PHI while still allowing authorized personnel to access the information they need to perform their job functions. Careful judgment is required to avoid both over-disclosure and under-access, both of which can have significant negative consequences. The correct approach represents best professional practice because it directly addresses the HIPAA privacy rules requirement to limit the use and disclosure of PHI to the minimum necessary to accomplish the intended purpose. By implementing role-based access controls and providing training on the minimum necessary standard, the organization ensures that only authorized individuals can access PHI and only the specific information required for their tasks. This proactive measure aligns with HIPAA intent to protect patient privacy while enabling effective healthcare delivery. An incorrect approach that involves broadly granting access to all EHR data for all clinical staff fails to adhere to the minimum necessary standard. This creates an unacceptable risk of unauthorized access and disclosure of PHI, violating HIPAA. Another incorrect approach, which involves manual review and approval for every single access request, is administratively burdensome and impractical for timely patient care, potentially hindering treatment and violating the spirit of efficient healthcare operations, even if it appears to be protective. A third incorrect approach, relying solely on technical safeguards without accompanying policies and training, is insufficient. HIPAA mandates a comprehensive approach that includes administrative, physical, and technical safeguards, as well as workforce training and policies. Professionals should employ a decision-making framework that begins with a thorough understanding of the relevant regulations. In this case, HIPAA. They should then assess the specific workflows and data access needs of different roles within the organization. Implementing a layered security approach, starting with role-based access controls and supplementing with ongoing training and policy enforcement, is crucial. Regular audits and reviews of access logs are also essential to identify and address any potential breaches or non-compliance. Question 12. Stakeholder feedback indicates that confusion persists regarding the appropriate application of CPT and HCPCS codes when documenting and billing for a complex patient encounter involving both a new patient visit and a minor surgical procedure performed on the same day. The physician's initial note summarizes the visit as new patient evaluation and management, followed by excision of a benign lesion. The Sayers needs to determine the most accurate coding strategy. Which of the following approaches best reflects professional practice and regulatory compliance for this scenario? Option A. Code the new patient evaluation and management service using the appropriate E/M code for a new patient, and then select a generic HCPCS code for minor surgical procedure without further specificity. Option B. Code a single, higher-level E/M code that encompasses both the evaluation and the minor surgical procedure as they occurred on the same day. Option C. Code only the surgical procedure, as it is the more significant service performed on the same day, assuming the E/M service was incidental to the procedure. Option D. Code the new patient evaluation and management service using the appropriate E/M code for a new patient, and separately code the excision of the benign lesion using the most specific CPT code for that procedure. Ensuring appropriate modifiers are used if the E/M service was significantly performed and documented separately from the surgical procedure. The correct answer is D. Code the new patient evaluation and management service using the appropriate E/M code for a new patient, and separately code the excision of the benign lesion using the most specific CPT code for that procedure. Ensuring appropriate modifiers are used if the E/M service was significantly performed and documented separately from the surgical procedure. Explanation. This scenario is professionally challenging because it requires the Certified Electronic Health Record Specialist, Sayers, to navigate the complexities of CPT and HCPCS coding within the context of a specific clinical encounter, ensuring accuracy for billing and reimbursement while adhering to regulatory guidelines. The Sayers must understand not only the procedural aspects of coding, but also the nuances of documentation and payer policies. The correct approach represents best professional practice because it prioritizes accurate and complete documentation as the foundation for appropriate coding. By reviewing the physician's documentation thoroughly, identifying all services rendered, and then selecting the most specific and accurate CPT and HCPCS codes, the Sayers ensures compliance with the principle of code what was done. This aligns with the Centers for Medicare and Medicaid Services, CMS, guidelines, which emphasize that codes must accurately reflect the services provided and be supported by documentation. Furthermore, understanding modifier usage is critical for accurately reporting services that might otherwise be bundled or require additional explanation, preventing claim denials and potential audits. An incorrect approach that relies solely on the physician's summary without verifying against detailed documentation is professionally unacceptable. This fails to meet the regulatory requirement that codes must be supported by the medical record. It can lead to undercoding or overcoding, both of which have significant ethical and financial implications, including potential fraud and abuse investigations. Another incorrect approach that involves selecting generic codes when more specific codes are available is also professionally unacceptable. This violates the coding principle of using the most specific code that accurately describes the service. Generic codes can lead to incorrect reimbursement and may trigger audits by payers who expect specificity. An incorrect approach that ignores payer-specific guidelines or policies for CPT and HCPCS coding is professionally unacceptable. While CPT and HCPCS codes are standardized, payers may have specific rules regarding their use, bundling, and modifier requirements. Failing to adhere to these can result in claim rejections or denials, impacting revenue cycle management and potentially leading to compliance issues. The professional decision-making process for similar situations should involve a systematic review of the patient encounter documentation. The SAYER should first identify all procedures, services, and supplies documented. Then, they should consult the current CPT and HCPCS codebooks, along with any relevant National Correct Coding Initiative, NCCI, edits and payer policies. The goal is to select the most specific and accurate codes that fully represent the services rendered, using appropriate modifiers when necessary to provide additional information or clarify circumstances. If documentation is unclear or incomplete, the SAYER should query the physician for clarification before assigning codes. Question 13. The audit findings indicate that a specific user account within the Electronic Health Records (EHR) system has accessed a disproportionately high number of patient records outside of their typical job function, raising concerns about potential unauthorized access or misuse of protected health information. 5. What is the most appropriate immediate next step for the certified electronic health record specialist to take in accordance with U.S. federal regulations? Option A. Immediately revoke the user's access to the EHR system and begin an investigation into their activity. Option B. Conduct a detailed technical analysis of the user's workstation and network activity to identify the root cause of the access pattern. Option C. Document the findings and escalate them to the organization's privacy officer and / or security official for further investigation and action. Option D. Inform the user directly about the audit findings and ask them to explain their access patterns. The correct answer is A. Immediately revoke the user's access to the EHR system and begin an investigation into their activity. Explanation. The audit findings indicate a potential breach in the secure handling of protected health information, (PHI), within the EHR system. This scenario is professionally challenging because it requires immediate and decisive action to mitigate harm, protect patient privacy, and ensure compliance with federal regulations, specifically the Health Insurance Portability and Accountability Act, HIPAA, in the United States. The EHR specialist must balance the urgency of the situation with the need for thorough investigation and adherence to established protocols. The correct approach involves a systematic and compliant response that prioritizes patient safety and regulatory adherence. This includes immediately reporting the suspected breach to the designated privacy officer or security official, as per HIPAA breach notification rule. This ensures that the organization can initiate its incident response plan, which typically involves assessing the scope of the breach, determining if notification to affected individuals and the Department of Health and Human Services (HHS) is required, and implementing corrective actions to prevent future occurrences. This approach aligns with the ethical obligation to protect patient confidentiality and the legal mandate to report breaches of unsecured PHI. An incorrect approach would be to ignore the audit findings or attempt to resolve the issue internally without proper reporting. This failure to report a potential breach violates the HIPAA breach notification rule, which mandates reporting within 60 days of discovery. It also demonstrates a lack of commitment to patient privacy and data security, potentially leading to significant fines, reputational damage, and loss of patient trust. Another incorrect approach would be to immediately implement technical fixes without a proper investigation. While technical solutions may be part of the remediation, a hasty implementation without understanding the root cause could be ineffective or even exacerbate the problem, and it bypasses the required reporting and assessment steps mandated by HIPAA. Finally, attempting to conceal the findings or downplay their significance is a severe ethical and legal violation, undermining the integrity of the EHR system and the healthcare organization. Professionals should approach such situations by first understanding the organization's established incident response plan. This plan should outline the steps for reporting, investigating, and mitigating security incidents and breaches. They should then gather all available information about the audit findings, document their observations meticulously, and communicate their concerns to the appropriate designated personnel without delay. The decision-making process should be guided by a commitment to patient privacy, data security, and strict adherence to HIPAA regulations. Question 14. Governance review demonstrates a need to leverage advanced analytics tools for predictive modeling of patient readmission rates. The organization is seeking to identify a solution that can process large volumes of EHR data to uncover patterns and risk factors. Which of the following approaches best aligns with U.S. regulatory requirements for health data analytics? Option A. Select a tool that offers robust de-identification and anonymization features compliant with HIPAA privacy rule, along with strong access controls and audit trails. Option B. Prioritize the tool that can process data at the highest speed, as rapid insights are crucial for timely interventions, even if detailed privacy compliance documentation is pending. Option C. Choose the analytics platform with the most sophisticated machine learning algorithms, assuming that any reputable cloud provider will meet U.S. privacy standards. Option D. Implement a tool that requires minimal configuration and offers direct access to raw EHR data for maximum analytical flexibility, without explicit data sanitization steps. The correct answer is A. Select a tool that offers robust de-identification and anonymization features compliant with HIPAA privacy rule, along with strong access controls and audit trails. Explanation. This scenario presents a common challenge in health informatics, balancing the potential of advanced analytics tools with the imperative to protect patient privacy and comply with regulations. The professional challenge lies in identifying and implementing analytical tools that can extract meaningful insights from EHR data, without compromising the confidentiality, integrity, and availability of that data, all while adhering to specific U.S. regulatory frameworks like HIPAA. Careful judgment is required to select tools that are not only technologically capable, but also demonstrably secure and compliant. The correct approach involves selecting an analytics tool that explicitly supports de-identification and anonymization techniques compliant with HIPAA privacy rule. This ensures that the data used for analysis is stripped of direct and indirect identifiers, thereby minimizing the risk of re-identification and unauthorized disclosure. Such tools often incorporate robust access controls and audit trails, further reinforcing compliance. This approach represents best professional practice because it prioritizes patient privacy and legal obligations as foundational to any data utilization strategy. It aligns with the ethical duty to protect sensitive health information and the legal mandates under HIPAA, which govern the use and disclosure of protected health information. 5. An incorrect approach would be to select a tool based solely on its advanced predictive modeling capabilities without verifying its data handling and privacy features. This failure to assess compliance with HIPAA privacy rule is a significant regulatory failure. It risks the unauthorized disclosure of PHI, leading to potential breaches, fines, and reputational damage. Another incorrect approach is to assume that all cloud-based analytics platforms inherently meet U.S. privacy standards, without specific due diligence and confirmation of HIPAA compliance, including business associate agreements, BA. Where applicable, using such a tool could lead to violations. This overlooks the responsibility of the covered entity to ensure their vendors are also compliant. A third incorrect approach is to prioritize the speed of data processing over the security and privacy controls of the analytics tool. While efficiency is desirable, it cannot come at the expense of regulatory adherence. This demonstrates a misunderstanding of the absolute priority of patient privacy and data security under U.S. law. The professional decision-making process should involve a multi-step assessment. First, clearly define the analytical objectives and the types of insights sought. Second, research and identify potential analytics tools, paying close attention to their stated features related to data security, privacy, and compliance. Third, conduct thorough due diligence on shortlisted tools, specifically verifying their adherence to relevant U.S. regulations, such as HIPAA. This includes reviewing their data de-identification capabilities, access control mechanisms, audit logging, and data residency policies. Fourth, engage legal and compliance teams to review vendor contracts and ensure appropriate safeguards are in place, including BAAs if necessary. Finally, implement a pilot program with strict oversight to monitor the tool's performance and compliance in a real-world setting before full deployment. Question 15. Comparative studies suggest that health information managers (HIM) play a critical role in balancing the needs of various stakeholders for access to electronic health record (EHR) data. When faced with a request from administrative leadership for direct, unfettered access to raw patient data for a new operational efficiency initiative, which of the following represents the most appropriate and compliant course of action for a HIM in the United States? Option A. Immediately deny the request, citing general privacy concerns and the complexity of EHR data, without exploring any potential compliant methods for data sharing or de-identification. Option B. Grant direct, unfettered access to the raw EHR data to the administrative leadership team, trusting their assurance that they will handle the data responsibly and adhere to privacy principles. Option C. Implement a robust data de-identification and anonymization process for the requested data, ensuring that only aggregated or de-identified information is provided to administrative leadership, and that all access is logged and audited according to established institutional policies and HIPAA regulations. Option D. Provide the raw EHR data to administrative leadership with a disclaimer that the organization is not liable for any privacy breaches that may occur, shifting the responsibility entirely to the requesting party. The correct answer is C. Implement a robust data de-identification and anonymization process for the requested data, ensuring that only aggregated or de-identified information is provided to administrative leadership, and that all access is logged and audited according to established institutional policies and HIPAA regulations. Explanation. Scenario analysis. This scenario presents a common challenge for health information managers (HIM), where competing stakeholder interests, particularly between clinical staff and administrative leadership, can create tension regarding the accessibility and use of electronic health record (EHR) data. The HIM role is to balance the need for efficient clinical care and research with the imperative of patient privacy and data security, all while adhering to regulatory mandates. The pressure to demonstrate value and efficiency through data utilization, juxtaposed with the strict requirements of HIPAA, Health Insurance Portability and Accountability Act, and other relevant U.S. federal and state laws, makes careful judgment essential. Correct approach analysis. The correct approach prioritizes a systematic, policy-driven, and compliant method for data access requests. This involves establishing clear protocols for data de-identification, anonymization, and secure data sharing, ensuring that all requests are reviewed against established institutional policies and regulatory requirements, such as HIPAA privacy rule. The HIM responsibility is to act as a gatekeeper and facilitator, ensuring that data is used ethically and legally for approved purposes, thereby protecting patient confidentiality and maintaining the integrity of the EHR system. This aligns with the HIM core responsibilities of data governance, privacy, and security. Incorrect approaches analysis. One incorrect approach involves granting direct, unfettered access to raw EHR data to administrative staff for ad hoc analysis without a formal review process. This violates HIPAA minimum necessary standard, as it could expose protected health information beyond what is required for the specific purpose. It also bypasses established data governance policies, increasing the risk of data breaches and misuse. Another incorrect approach is to deny all requests for data access for research or quality improvement initiatives, citing only general privacy concerns without exploring compliant methods of data sharing. This hinders the advancement of healthcare knowledge and operational improvements, potentially contravening institutional goals and the spirit of data utilization for public good, provided it can be done ethically and legally. It also fails to leverage the HIM expertise in finding compliant solutions. A third incorrect approach is to rely solely on the requesting party's assurance of data security and privacy without independent verification or the implementation of technical safeguards. This abdicates the HIM responsibility for data stewardship and exposes the organization to significant legal and reputational risks if a breach occurs. Professional reasoning. Health information managers must adopt a decision-making framework that begins with understanding the request's purpose and scope. They should then consult relevant institutional policies and regulatory frameworks, primarily HIPAA in the U.S. context. If the request involves PHI, the HIM must assess whether de-identification or anonymization is feasible and appropriate. If direct access is necessary, the HIM must ensure that the minimum necessary standard is met and that appropriate safeguards are in place. Collaboration with legal counsel and the Institutional Review Board, IRB, may be required. The HIM role is to enable responsible data use while upholding legal and ethical obligations. Question 16. Assessment of an organization's current data analytics capabilities reveals a desire to proactively identify potential patient safety risks within the electronic health record system. The SAERS is tasked with recommending the most appropriate initial analytical approach to support this goal. Option A. Utilizing descriptive analytics to summarize historical patient safety events and identify trends. Option B. Implementing prescriptive analytics to recommend immediate changes to clinical workflows based on hypothetical scenarios. Option C. Focusing solely on predictive analytics to forecast future adverse events without understanding past occurrences. Option D. Employing advanced machine learning algorithms for complex data mining without a clear initial objective. The correct answer is A. Utilizing descriptive analytics to summarize historical patient safety events and identify trends. Explanation. This scenario presents a professional challenge because it requires a certified electronic health record specialist SAERS to discern the most appropriate type of health data analytics for a specific organizational goal, balancing efficiency, regulatory compliance, and the ultimate benefit to patient care. The SAERS must understand the nuances of each analytical approach and how they align with the stated objective of identifying potential patient safety risks. Careful judgment is required to avoid misapplying resources or drawing inaccurate conclusions that could lead to ineffective interventions or even patient harm. The correct approach represents best professional practice because it directly addresses the organization's need to proactively identify potential patient safety risks. Descriptive analytics, by summarizing past events and identifying trends, provides the foundational understanding of what has happened. This is crucial for recognizing patterns that might indicate safety issues, such as an increase in adverse drug events or a rise in hospital-acquired infections. This aligns with the SAER's ethical and professional responsibility to ensure the integrity and utility of health data for improving patient outcomes, as mandated by regulations like HIPAA, which emphasizes the use of protected health information, for quality improvement activities. An incorrect approach that focuses solely on predictive analytics without a descriptive foundation would be professionally unacceptable. While predictive analytics aims to forecast future events, it relies on historical data patterns. Without first understanding what has occurred, descriptive analytics, any predictions would be speculative and potentially inaccurate, leading to misallocation of resources or false alarms. This could violate ethical principles of responsible data use and potentially lead to regulatory scrutiny if PHI is used in a manner that does not demonstrably contribute to patient safety or quality improvement. Another incorrect approach that relies exclusively on prescriptive analytics without understanding the underlying issues would also be a failure. Prescriptive analytics suggests actions to take. Implementing prescriptive measures without a clear understanding of the root causes identified through descriptive or predictive analysis could lead to ineffective or even harmful interventions. This demonstrates a lack of due diligence in data analysis and could be seen as a breach of professional responsibility to ensure data-driven decision-making that genuinely benefits patients. Furthermore, it could lead to non-compliance with regulations that require evidence-based practices for patient care. The professional decision-making process for similar situations should involve a systematic evaluation of the organizational objective. First, clearly define the problem or goal. Second, consider the available data and the types of insights that can be derived. Third, match the analytical approach to the objective, understanding that often a combination of approaches is most effective. For identifying potential patient safety risks, starting with descriptive analytics to understand past events and trends is a logical and compliant first step. This forms the basis for more advanced analytics and ensures that interventions are informed by actual data. Professionals should always prioritize approaches that demonstrably contribute to patient well-being and adhere to all relevant privacy and security regulations. Question 17. When evaluating a proposed new feature for a healthcare organization's electronic health record, AIR system. Which of the following best aligns with the definition and primary purpose of an EHR under U.S. regulatory frameworks? Option A. An open forum where patients can post and discuss unverified health advice and personal remedies without clinical moderation. Option B. A system that automatically shares all patient visit summaries with a publicly accessible online health blog for general public awareness. Option C. A module that enables third-party marketing companies to access anonymized patient demographic data for targeted advertising campaigns. Option D. A secure patient portal that allows individuals to view their laboratory results, medication lists, and upcoming appointment schedules, and to communicate securely with their care team. The correct answer is D. A secure patient portal that allows individuals to view their laboratory results, medication lists, and upcoming appointment schedules, and to communicate securely with their care team. Explanation. This scenario presents a common challenge in healthcare IT, balancing the need for efficient data access with the imperative to protect patient privacy and ensure data integrity, as mandated by U.S. regulations like HIPAA. The core of the challenge lies in understanding the fundamental definition and purpose of an electronic health record, AIR, system within the legal and ethical framework governing protected health information, FI. A sales professional must discern which proposed system functionalities align with the intended use of an EHR, and which might inadvertently create risks or misinterpret the system's role. The correct approach recognizes that an EHR's primary purpose is to provide a comprehensive, longitudinal record of a patient's health status and care, facilitating clinical decision-making, care coordination, and patient engagement. It is designed to capture, manage, and share health information securely. This approach correctly identifies that functionality supporting these core purposes, such as secure patient portals for accessing test results and appointment scheduling, directly align with the definition and purpose of an EHR. These features enhance patient access to their own health information and streamline administrative processes, all within a secure, regulated environment. An incorrect approach might misinterpret the EHR's purpose as a general-purpose data repository or a marketing tool. For instance, integrating a system that allows third-party advertisers to access patient demographic data for targeted marketing campaigns would be a significant regulatory and ethical failure. This violates HIPAA privacy rule, which strictly limits the use and disclosure of PHI without patient authorization for purposes other than treatment, payment, or healthcare operations. Such an action would expose the organization to severe penalties and erode patient trust. Another incorrect approach might be to view the EHR as a platform for unverified health advice or self-diagnosis tools without proper clinical oversight. While patient engagement is a goal, the EHR's primary purpose is to support clinically validated information and care processes, not to replace professional medical judgment or provide a forum for unvetted health content. This could lead to patient harm and contravenes the principle of providing accurate and reliable health information. Professionals should approach such decisions by first grounding their understanding in the regulatory definition of an EHR and its intended purposes under applicable laws, such as HIPAA. They must then critically evaluate proposed functionalities against these core principles. A decision-making process should involve asking, does this functionality directly support patient care, improve clinical decision-making, enhance care coordination, or facilitate patient engagement with their health information in a secure and compliant manner? Does it align with the principles of data integrity, confidentiality, and availability? If a proposed feature deviates from these core purposes or introduces undue risk to PHI, it should be rejected or significantly modified to ensure compliance and ethical practice. Question 18. The audit findings indicate a pattern of inconsistent demographic data entry for a subset of patients within the electronic health record system, leading to potential downstream impacts on billing and patient outreach. As a certified electronic health record specialist, what is the most appropriate immediate course of action to address this data quality issue? Option A. Document the discrepancies and recommend that the affected departments address the data quality issues independently at their convenience. Option B. Advise the audit team that the identified data inconsistencies are minor and unlikely to cause significant operational problems, suggesting they be addressed in a future system update. Option C. Initiate a review of the data entry workflows and user training materials related to demographic information, and collaborate with clinical and administrative staff to identify the root cause of the inconsistencies and implement targeted retraining and system enhancements. Option D. Immediately correct all identified demographic data discrepancies across all affected patient records to ensure accuracy for current operations. The correct answer is C. Initiate a review of the data entry workflows and user training materials related to demographic information, and collaborate with clinical and administrative staff to identify the root cause of the inconsistencies and implement targeted retraining and system enhancements. Explanation. This scenario is professionally challenging because it requires balancing the immediate need for accurate patient care with the long-term implications of data integrity and compliance. The Certified Electronic Health Records Specialist, SERS, must navigate potential conflicts between different stakeholder priorities, such as a clinician's desire for quick access to information and the need for systematic data validation. Careful judgment is required to ensure that any corrective actions taken do not compromise patient safety or violate regulatory mandates. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based resolution that aligns with the Health Insurance Portability and Accountability Act, HIPAA Security Rule, and the American Health Information Management Association, AHIMA Code of Ethics. Specifically, it addresses the root cause of the data quality issue, involves relevant parties for a comprehensive understanding, and implements corrective actions that enhance data integrity and prevent recurrence. This proactive and collaborative method ensures that the EHR system remains a reliable source of information for patient care, research, and reporting, thereby upholding the trust placed in health information professionals. An incorrect approach that focuses solely on immediate data correction without investigating the underlying cause fails to address systemic issues, potentially leading to repeated errors and undermining the overall reliability of the EHR. This could violate HIPAA requirements for safeguarding electronic protected health information, E5, by not implementing adequate internal controls to ensure data accuracy and completeness. Another incorrect approach that involves unilateral correction of data by the SERS without proper authorization or documentation bypasses established protocols and could lead to unauthorized alterations of patient records. This is a direct violation of HIPAA privacy rule, which mandates strict controls over access and modification of PHI, and also breaches ethical principles of transparency and accountability in health information management. A third incorrect approach that dismisses the audit findings due to perceived minor impact overlooks the cumulative effect of data inaccuracies. Even small errors can have significant consequences for patient safety, clinical decision-making, and regulatory compliance. Ignoring such findings demonstrates a lack of diligence and a failure to uphold the professional responsibility to maintain high standards of data quality, which is a core tenet of the SERS role and is implicitly supported by HIPAA emphasis on data accuracy. The professional reasoning process for similar situations should involve 1. Acknowledging and thoroughly understanding the audit findings. 2. Identifying all relevant stakeholders and their perspectives. 3. Investigating the root cause of the identified data quality issues. 4. Developing and implementing a corrective action plan that addresses the root cause and includes measures to prevent recurrence. 5. Documenting all actions taken and communicating them to relevant parties. 6. Ensuring all actions comply with applicable regulations such as HIPAA and professional ethical guidelines. Question 19. Cost-benefit analysis shows that developing a custom, non-standardized data exchange protocol for a new EHR integration would be faster and cheaper in the short term compared to implementing HL7F-HER. However, the organization is aiming for broad interoperability with other healthcare providers and adherence to federal regulations promoting seamless data exchange, which approach best aligns with the Certified Electronic Health Records Specialist's professional responsibilities and regulatory compliance. Option A. Develop a proprietary data exchange protocol to meet immediate integration needs and budget constraints. Option B. Implement HL7F-HER to ensure standardized data exchange and future interoperability, despite higher initial costs. Option C. Rely on manual data entry and exchange methods to avoid the complexities of any new protocol. Option D. Utilize an older, less common HL7 standard that is familiar to the internal IT team but not widely adopted. The correct answer is B. Implement HL7FHER to ensure standardized data exchange and future interoperability, despite higher initial costs. Explanation: this scenario is professionally challenging because it requires balancing the immediate benefits of improved data interoperability with the long-term risks associated with inadequate adherence to established standards. The certified electronic health record specialist must understand that while a custom solution might seem efficient in the short term, it can lead to significant compliance issues and hinder future system integration. The correct approach represents best professional practice because it prioritizes adherence to HL7 standards, specifically FHER, Fast Healthcare Interoperability Resources. FHER is the current generation of HL7 standards designed for the exchange of healthcare information electronically. By leveraging FHER, the organization ensures that its EHR system can communicate effectively with other healthcare systems, a critical requirement for interoperability and patient care coordination. This aligns with the overarching goals of healthcare IT regulations, which emphasize seamless and secure data exchange. Using FHER also future-proofs the system, making it easier to adopt new technologies and comply with evolving regulatory mandates. An incorrect approach that involves developing a proprietary messaging format fails to meet regulatory requirements for interoperability. Regulations, such as those under the Health Insurance Portability and Accountability Act, HIPAA, in the U.S., mandate the use of standardized formats for electronic health information exchange. A proprietary format would create data silos, making it impossible for other healthcare providers or systems to interpret the data, thus violating the spirit and letter of these regulations. This also poses a significant security risk, as proprietary formats are less likely to have undergone the rigorous security testing and validation applied to widely adopted standards like HL7. Another incorrect approach, relying solely on manual data transfer methods, is not only inefficient, but also a direct violation of regulations promoting electronic data exchange. Such methods are prone to human error, compromise data integrity, and are incompatible with the interoperability goals of modern healthcare systems. This approach completely disregards the technological advancements and regulatory imperatives for electronic health records. The professional decision-making process for similar situations should involve a thorough understanding of current and emerging HL7 standards, particularly FHER. It requires evaluating potential solutions against regulatory mandates for interoperability, data security, and privacy. A key step is to consult official documentation and guidance from regulatory bodies and standards organizations. When faced with a choice between a custom, non-standard solution and a standards-based approach, the professional should always advocate for the latter, even if it requires a greater initial investment, due to the long-term benefits of compliance, interoperability, and system scalability. Question 20. Upon reviewing a request from a patient's employer for a summary of the patient's current medical condition to support a disability claim, what is the most appropriate and legally compliant course of action for a certified electronic health record specialist? Option A. Obtain a signed, written authorization from the patient, specifically permitting the release of their medical condition summary to their employer for disability claim purposes. Option B. Provide the employer with a general overview of the patient's health status without specific details, as this is a common practice for supporting disability claims. Option C. Inform the employer that the request cannot be fulfilled due to privacy concerns and do not provide any information. Option D. Release a summary of the patient's medical condition directly to the employer, as this information is needed to process a disability claim. Correct answer is A. Obtain a signed, written authorization from the patient, specifically permitting the release of their medical condition summary to their employer for disability claim purposes. Explanation: scenario analysis. This scenario presents a common challenge in health record management, balancing the need for data accessibility for patient care with the legal and ethical obligations to protect patient privacy. The core tension lies in responding to a request that, while seemingly straightforward, could inadvertently breach patient confidentiality if not handled with extreme care and adherence to regulations. The professional challenge is to identify the appropriate legal and regulatory pathway for fulfilling the request while safeguarding sensitive health information. Correct approach analysis. The correct approach involves recognizing that a direct release of information without proper authorization or a clear legal basis is a violation of patient privacy rights. The Health Insurance Portability and Accountability Act, HIPAA, privacy rule in the United States, governs the use and disclosure of protected health information. A valid written authorization from the patient is the most common and legally sound method for releasing PHI to third parties, especially when the purpose is not directly related to treatment, payment, or healthcare operations. This approach ensures patient autonomy and compliance with federal law. Incorrect approach is analysis, releasing the information directly to the patient's employer without a signed authorization from the patient or a specific legal exception, such as a court order or subpoena, constitutes a breach of HIPAA. This violates the patient's right to privacy and the confidentiality of their health information. The employer is a third party in this context, and their need for the information does not override the patient's privacy rights under HIPAA. Providing a summary of the patient's condition without the patient's explicit consent or a specific legal mandate is also a violation. While the intent might be to assist the patient, it still involves the disclosure of PHI without proper authorization. The scope of the information disclosed, even if summarized, is still considered PHI and is protected. Ignoring the request and not responding at all is also professionally problematic. While it avoids a direct breach, it fails to address the patient's needs and could lead to a complaint or further complications. Healthcare providers have an obligation to respond to requests for information in a timely and compliant manner, even if that response is to explain the necessary procedures for obtaining the information. Professional reasoning. When faced with requests for health information, professionals must adopt a systematic decision-making process. First, identify the nature of the information requested and the requesting party. Second, determine the legal and regulatory framework governing the disclosure. In the U.S., this is primarily HIPAA. Third, assess whether a valid authorization exists or if any exceptions to the authorization requirement apply. If neither is present, the appropriate course of action is to inform the requester of the necessary steps to obtain the information legally, which typically involves obtaining patient authorization. This process prioritizes patient rights and regulatory compliance.